Hello and welcome to the Pets Digest YouTube channel. I'm Courtney and today we are going to talk about chronic diarrhea in dogs. I am a veterinarian and this was my dog Chi Chi. He unfortunately passed when he was 16, going on 17, obviously, and he had pancreatitis. So, chronic diarrhea is something that I dealt with for a lot of his life, off and on. So there are a lot of causes of chronic diarrhea in dogs, and we're just going to touch on some of them and some of the things you can do to kind of help your dog if they do have chronic diarrhea. So chronic diarrhea, or also known as chronic enteropathy, is when a dog has had diarrhea for at least 2 weeks. So this can be off and on as well. It can include diarrhea that responds to treatment, but it consistently returns. So, some of the common causes are dietary indiscretion. So, in other words, you have a dog that's out eating everything, maybe gets in the garbage a lot. Infectious causes, parasitic infections, things like Giardia will cause chronic diarrhea. It can take a while for those infections to go away. Sometimes cancers, some types of cancers, diseases, genetic causes, and diseases like pancreatitis, like with my dog. Food allergies and intolerances can also cause chronic diarrhea in dogs. So, a lot of owners will first try to treat it home before they bring their dog into a vet. And usually do this with a bland diet. And sometimes this works, sometimes it helps. If it doesn't help, then they will usually proceed to take them to a veterinarian where a lot of times the vet will wonder, what did the dog eat? How old is the dog? If it's a puppy, you think about worms, so you may deworm them. There are some over the counter medications that can help with dogs that have diarrhea, as well as fiber. Your vet may want to give you that too. So, there are some questions that I think that most pet owners should ask themselves if they recognize that their dog is having chronic diarrhea. Like, if you say your dog had diarrhea Monday and then it went away and then it's coming back on Wednesday. So, these are some questions you should ask yourself. So, has your pet eaten anything out of the ordinary? Have they gotten into the garbage? Have they gotten some table food, even a small piece of table food? Did you change the food at all? Because a lot of times this can cause diarrhea and vomiting as well. Do they have all of their vaccinations? And this is usually if for puppies. Adult dogs too, if they don't have any vaccinations, but usually once they're adults, they have at least have had some vaccinations. But in puppies, you think about parvovirus initially with any chronic diarrhea or even just diarrhea initially, especially bloody diarrhea in puppies or worms, those type of things you'll see a lot. But for vaccinations, you want to make sure that your puppy has all of their booster shots so that they are not susceptible to things like parvovirus. Also, did you notice anything in the stool? You may not want to check out your dog's stool, but sometimes if they have chronic diarrhea, you may have to do those things. So you want to look for worms, you want to look for blood, excessive mucus, foreign bodies like plastic and things like that, and also bones, which we see a lot. So if your dog's diarrhea, goes on for a couple of days, even after you've treated them at home with a bland diet, you definitely want to take them in to see your vet. I wouldn't wait, a week or so to see your vet. Be sure that you bring a stool sample with you. If you can collect one that's fresh the same day, like right before you go in, that will be optimal. I wouldn't get one, from a couple of days ago. Make sure it's fresh. Your vet will probably want to start off with doing a fecal flotation to check for worms and parasites and things like that. They may also want to run some blood work. They may need to do x-rays or ultrasounds depending on what they believe it is. So if they believe it is a foreign body, your vet will want to do some x-rays. If the diarrhea just will not go away, a lot of times you want to look for infectious causes like Giardia. Again, like I said, those cases sometimes can take months to go away. I do have an article about Giardia and treating it, and to try to help the infection from presenting itself over and over and over, or the dog reinfecting themselves. So I do have an article about that on my blog. Also, another thing you want to think about if diarrhea will not go away, it's cancer, unfortunately, in some dogs. Also, GI diseases like chronic colitis and pancreatitis, like I said before, can definitely cause some intermittent diarrhea. So, and this will may be for life. So it's really important with these diseases and these issues that you get a handle on your dog's food. So no table food. They may be on a special food. My dog, I had him on a special low fat diet, and I also cooked for him as well. And that's one reason why I started the website, because he did so well with the diet and me cooking for him as well. He was a real foodie, so he didn't like the prescription diet. So I had to always, try to beef it up or find something that he would like so that he could eat it, but also that wouldn't cause him to have any flare ups or anything with his pancreatitis. Another thing that you may think about too is food allergies and food intolerances. So they do have some food allergy tests on the market. Some are better than others. So I would definitely speak with your vet about getting a food allergy test if you think that's what it is. Or the easiest and simplest thing to do is to try to eliminate certain foods from your dog's diet. So a lot of times dogs, if they are allergic to something, it's going to be the protein in the diet. And usually it's chicken or beef. So you can try to eliminate that from your dog's diet. Look at the treats too that you feed him or her, and make sure there's no chicken or beef in them, and then just do like a food elimination trial. That's the easiest and most cost effective thing you can do in that case. So, if your dog has chronic diarrhea, there is most likely a common cause for it. The biggest issues develop when the problem is allowed to persist for an extended amount of time. So, your dog's best chances of getting better is to make sure that you get an early diagnosis and that you treat it early on with your vet. And that is all I have for you today. I hope that you will check out my website, The Pets Digest, and join our newsletter family. I have a weekly newsletter that comes out, and it includes free courses, events, updated research around animals and gut health. So, and I will